Hi, my name is Allison Johnston. I am a Master's of Science Nursing student at Eastern Kentucky University. Today I will be presenting a proposed project for NSC 892 concerning the effects of an online educational program in reducing the prevalence of childhood obesity. Childhood obesity is an area of significant concern within the United States, affecting about one-third of the nation's youth. Public health statistics indicate that about 16% of Kentucky children ages 2 to 5 years old are considered overweight or obese. Research indicates that chronic disease conditions are among the many complications overweight and obese children face. These disease conditions may include cardiovascular disease, metabolic, gastrointestinal, skeletal, and neurological complications. Coronary artery disease, migraine headaches, asthma, and sleep apnea are also included. Obesity may threaten a child's psychological well-being as well. The purpose of this proposed project is to implement a theory-based online educational program targeted toward parents to improve 4 behaviors known to prevent childhood obesity in children ages 2 to 5 years old. The 4 behaviors include screen time, time spent engaging in physical activity, amount of sugar-free beverages consumed, and amount of fruits and vegetables consumed. The target audience is parents ages 18 years and older with at least one child between the ages of 2 and 5 years. Studies indicate that family and home-based interventions have shown limited success for improving behaviors associated with childhood obesity. Previous research has shown a need for targeting parents for agents of change in the prevention and treatment of childhood obesity. Healthy behaviors instilled within the home, particularly during the early years of a child's life, may track with age and aid in the primary prevention of obesity. After an extensive literature search, 4 Level 2 studies were selected for inclusion in the proposed project. Inclusion criteria included whether the study examined the effects of an online educational program targeted toward parents, and whether the study results demonstrated a change in child behaviors known to prevent childhood obesity. Each of the studies included a theory-based educational module that addressed the 4 child behaviors believed to prevent childhood obesity. Each of the 4 studies indicated an improvement in at least one of the 4 behaviors following intervention. Strength of these studies included, among many other things, ease of replicability, sustainability in real-world practice settings, strong external validity, and program acceptance among participants. Limitations to the studies included limiting mothers as the sole agents of change, self-reporting of the children's behaviors by parents, failure to record body mass index scores of the children, and insufficient sample sizes. The first step in this proposed project would be recruiting prospective participants through flyers placed at healthcare and child care organizations throughout Madison County, Kentucky. Inclusion criteria would include English-speaking parents at least 18 years or older who have at least one child between the ages of 2 and 5 years old. Participants must also have the capability for daily access to the internet and adequate computer skills to complete intervention. Exclusion criteria would include parents without internet access, parents with a child between the ages of 2 and 5 with a disability or chronic medical condition inhibiting physical activity, parents with a child between the ages of 2 and 5 who have been prescribed a medication associated with weight gain, and or children between the ages of 2 and 5 years old participating in a weight management program, parents younger than 18 years of age. About 50 eligible participants would be invited to attend an educational session with the project's assigned faculty advisor and principal investigator on Eastern Kentucky University's Richmond campus. During this session, participants would be presented with a comprehensive overview of the project and its associated activities. No incentives would be offered, and there would be no cost to the participants. After being informed that participation is strictly voluntary, participants would be given the opportunity to sign informed consent. Participants would then be given written instructions on how to register online for the program. Data will be collected from a pre-intervention study created on SurveyMonkey that will ask participants to rate their child's level of participation in the 4 childhood behaviors. After the initial survey is complete, participants would register for and engage in the intervention, which is a 30-minute interactive online presentation developed by the project team. Upon completion of the intervention, participants would be emailed links to follow-up surveys on SurveyMonkey. The follow-up surveys would be administered at 1 month post-intervention, 6 months post-intervention, and 1 year post-intervention. Data would be accessed from scores obtained from participants' online interaction with the educational session. Data would be analyzed through the statistical package of the social sciences, a computer program used for statistical analysis. Potential risks involved with the proposed project are minimal. These risks may include sharing personal and sensitive information and registering for and using the online educational program. Because the internet is being used, there's a chance someone could access online records without permission. Measurable objectives within the project would include improvement in the 4 behaviors associated with childhood obesity, and these outcomes would be measured through analysis of data collected through surveys administered throughout the project. This project would place the highest importance upon minimizing any potential harm to participants while maximizing possible benefits to both participants and the community. Potential benefits of the project could include an improvement in the childhood behaviors known to prevent obesity and a reduction in the prevalence of obesity amongst children in the participants' homes and within the community. Thank you very much for your time.